They're the frontline workers who come face to face with COVID-19 every day. Healthcare professionals, including nurses, who during this unprecedented time are tasked with the most difficult jobs.
They're there at the front line, but there's concern and there's caution.
Already, the Ontario Nurses Association says they're starting to hear of healthcare workers testing positive for COVID-19 and others waiting for test results. And as the pandemic escalates, the ONA says it's vital that these frontline workers be equipped with the necessary personal protective equipment, crucial items like masks and gear.
We have research, and we're working with research that demonstrates that the protective equipment not only is critically important, but the right level is important.
Are there nurses who don't have the necessary PPEs or concerns that...
That is true. There are nurses that are concerned about the level of protection that they have in their work sites today, and also that there will be enough for when they really need it.
Some frontline professionals are currently working in hospitals at capacity, bracing for what could be the worst. In these moments, they say they're concerned they don't have what they need to deal with the pandemic, asking the governments to provide higher forms of respiratory protection to more nurses.
We're talking to the politicians to let them know that nurses and healthcare workers need to be protective. They agree, but it's the degree of protection that we're having some difficulty with. We want to make sure that, the supply's there, and also that it's available to those who need it.
The province says it has outlined guidelines, including some precautions healthcare workers should be taking during the spread of COVID-19.
We would ask that they approach the regional table to see about that issue per se. If it is a system-wide thing with a certain group that is a pan-Ontario group that needs a decision, that's something that we forward to our command table. But we've been trying to work through at our regional tables to look at those local needs and see how they can be dealt with.
A lot of these nurses also on duty during the SARS crisis. Some contracted the viral respiratory disease while providing care. And 2 nurses in the GTA died as a result.
That memory is very raw, and it really, today, it has become more pronounced.
There is a shortage of nursing staff here in Ontario, with hundreds of vacancies up across healthcare sectors. Just recently, there was a call out for nurses who left the industry but still have their license to get reinstated. In Toronto, I'm Faiza Amin for City News.